Joining us for more perspective on the pandemic is Dr. Uzma Syed, an infectious disease specialist and head of the COVID task force at Good Samaritan Hospital in Long Island, New York. Dr. Syed, good morning. I know you have been in the thick of it, at one point working at 3 different hospitals, 16-hour shifts. Give us some perspective, doctor. What's it like inside these hospitals now?
Good morning, Elaine. My colleagues and I have really been at the forefront of this pandemic for a year now, and healthcare workers have been doing this for a long time, and frankly, they are exhausted. With the ongoing rising cases, hospitalizations, and deaths, it just seems like there's no end in sight.
Dr. Syed, you say that your peers are exhausted. Do you see any room for improvement that you're hoping to see in the coming days or weeks as we continue to fight this?
Well, that's really the message that we keep getting out to Americans, is that, we each have a part to play in all of this. We're in this together. The more that people can wear their masks and socially distance and just really avoid all those behaviors that help virus transmission, and especially as everyone is moving indoors and with the holidays and with the abundance of travel, our hospitals are already full of patients, and it's really alarming. And, we still do not have a cure that's a medication that's 100% curative of this virus. So we want people to know, with over 300,000 people that have lost their lives, we are doing everything that we can every day to save lives.
Dr. Syed, I wonder what you would say to folks who might be traveling as you think about your own experience and the experience of your colleagues who have been on the front lines. If you could give people advice on what they might do when they come home from traveling, what they might do when they arrive at their destinations that you think might mitigate the situation so people like you aren't seeing increased cases.
Absolutely. I mean, pandemic fatigue is real. We are all feeling it. All of us, even in healthcare, want our lives back to normal more than anyone else. For travelers, I would really urge them that a test is really a snapshot in time. So the best thing to do is to really quarantine before your departure. And then after your arrival, you really need to quarantine as well, because now you've just had high risk of exposure. So, having a negative test right before your travel does not, in fact, clear you of infection, because you may be incubating, you may have been exposed during your travel. So it's really prudent to continue quarantining after you've arrived at your destination for about 2 weeks.
Doctor, parts of England and South Africa are obviously experiencing this new variant, this new piece of COVID-19, if you will, that spreads even more easily than what we've been talking about for the past 9 months. Do you see the current vaccines that we have as being able to protect against those new variants?
There is really good reason to believe that the vaccines will be effective. And in fact, the manufacturers are testing them because, the vaccine produces immunity in many different ways. So we really have good reason to believe that the vaccines will be effective. But the most important thing to remember is that the tools that we have to fight against transmission of this virus are still effective against this variant. And those include wearing a mask, socially distancing, and really avoiding indoor gatherings with people that are outside of your household.
Great tips. Thank you so much, Dr. Uzma Syed. We appreciate it.